Good morning, everyone. All right, all right. So first of all, I want to thank every single individual in this room right now. I want to thank you for being here. I am truly humbled by your presence. It means so much to me in immeasurable ways. You have no idea. Thank you. I want to thank Provost Fleming and the entire New York University administration for supporting these type of conversations that we know are so vital, and for letting us take the lead in anti-poverty research that accounts for race and racism. Also, thank you, Dr. Jackard and the entire Silver School of Social Work family for supporting the McSilver Institute's mission to investigate the root causes and consequences of poverty and to rapidly translate our research findings into action through policy and practice. The Silver School is training the next generation of social workers, and we appreciate the influence that the Silver School and the McSilver Institute share in this defining task. Today is special on so many levels, so many levels. Scientifically, it is dedicated to unpacking everything we know about the interrelatedness of race and poverty so that we can translate that knowledge into useful policy and evidence-informed practice. As a science, we are just beginning to acknowledge and study the many ways race and poverty inform one another in terms of education, mental health, housing, criminal justice, and so many other determinants. Indeed, as we unearth this knowledge, we discover better, more effective ways to disrupt structural racism. This effort is deeply personal to me and has defined my career. So I'm going to tell you a little bit about me. I grew up in inner city Southeast Washington, D.C., one of 5 boys raised by a single mother. I used to wonder why our lot in life and the course we would take was made so hard. My mother herself, a high school dropout, who would later go on to earn an associate's degree, emphasized the importance of going to school every day, without fail, every day, and bringing home good grades without fail. These were non-negotiable protective factors that shielded us from the deleterious elements of an urban inner city life as a black male. She indeed was a foremost scholar and an intervention scientist to the highest degree. Navigating such terrain also has a way of preparing you for moments like this. Leading a major entity like the McSilver Institute for Poverty Policy and Research is no easy task. Yet there is no greater time in which to lead it. Our country, on the heels of seeing its first black president complete an 8-year term, has ostensibly resolved the racial divide. For surely a country who can rise above a notoriously heinous history of racial subjugation and oppression to elect a black president to lead the most important country in the modern world and actually live in a house built by slaves means that we have conquered the racial divide, right? To answer this question, one has to look no further than the education of its most precious citizens, children. A closer examination of the educational disparities paints a disturbing picture of poor ethnic minority youth. Minority students graduate at lower rates than their white and Asian peers. They drop out at higher rates than their peers and even score lower on exams. Additionally, poverty and race are inextricably linked. Black and Latino students are overrepresented in high poverty schools. According to recent data from the National Center of Education Statistics, some 40% of students nationwide attend urban schools that are located in high concentrated impoverished areas, with black Latino, Native American, Alaskan Native students attending in higher percentages. Our very own city, New York, has one of the most segregated school systems in the nation. In a 2014 report from UCLA, it was found that the typical New York City student attends a school with the majority of their same race. Even more so, the typical Black and Latino student is enrolled in schools with less than 10% of white students. With these statistics, what these statistics show is that in a city which prides itself on diversity and inclusion, the exact opposite is occurring within its schools. It is not a coincidence that 96% of Black and 95% of Latino students attend majority low-income schools. But this is not simply a New York City issue. This is a national issue. According to an analysis from the National Equity Atlas, in the 90 of the largest US cities, more minority than white students attend public schools where most of their classmates qualify as poor or low income. A 2008 study found that even poor school building condition negatively affects student attendance rates and academic achievement. Why does this type of segregation matter? Because a study by Johnson and Shoney in 2011 found that Black students who attended desegregated schools for at least 5 years had better health by middle age than their counterparts from segregated school settings. Alas, there are consequences of the social injustice that low-income youth of color endure within our educational institutions. To address these disparities, greater access to resources that support well-being and positive outcomes must become a priority. I believe that every student in New York City, public and charter schools alike, should have access to supportive services to redress the barriers that inhibit their academic success. Social, emotional interventions and mental health services are key. Everything, in my opinion, points to the school as being the ideal setting to reach youth and families who would otherwise forego mental health treatment or who would otherwise not have access to much-needed services. After all, mental well-being and positive adjustment translate to academic success on many fronts. Schools have the ability to be prime settings for at-risk populations of children to access needed services. My research has examined this issue and explored various barriers to care for urban youth of color, which more often than not prevent them from receiving appropriate treatment. These barriers can include cultural factors like stigma, mistrust of white professionals, and logistical barriers such as transportation. Utilizing schools as a venue for formal mental health prevention and intervention presents a unique opportunity to reduce the number of potential barriers to treatment for at-risk youth. It is my hope that through a growing body of research, the case for mental health treatment and other supportive interventions in schools can be made and carried out. This indeed will be a priority area for the McSilver Institute. It is because of my personal and professional history as a child and adolescent mental health services and intervention researcher that I am particularly honored to fulfill the mission set forth by the Institute's founders, Constance and Martin Silver, building on the great foundation laid by McSilver's inaugural director, Dr. Mary McKay. My work and vision are perfectly aligned with the McSilver Institute's commitment to dismantling systems that oppress families and communities living in poverty, engaging community stakeholders as true partners to ensure the relevance and sustainability of our efforts, and bridging the gap between research and practice. Today, we are privileged to host many compelling speakers who share that commitment and offer a spectrum of knowledge and experience surrounding race and poverty. In fact, we've gathered together experts at the top of their respective fields, representing perspectives from government and policy, clinical research, economics, philanthropy, service-based nonprofits, as well as journalism and mass media. We owe thanks to the United States Deputy Surgeon General, Rear Admiral Dr. Sylvia Trent Adams, a clinician as well as a visionary leader who served the U.S. Public Health Service and Office of the Surgeon General with distinction. Dr. Cheryl Boyce is Chief of the Implementation Science Branch of the Center for Translational Research and Implementation Science at the NIH's National Heart, Lung, and Blood Institute. Dr. Garth Graham is president of the Aetna Foundation, where he oversees strategies aimed at giving underserved communities access to quality health care and had a hand in implementing health equity provisions of the Affordable Care Act. Dr. Lisa Genet is a research professor at NYU Steinhardt's Institute for Human Development and Social Change, whose active studies on anti-poverty measures and family interventions draw on her background as a behavioral economist. Ann Williams-Isom is CEO of the Harlem Children's Zone, a thriving organization serving tens of thousands that grew from a one-block pilot program based on the idea that child success can be supported by community strengthening. Finally, Tavis Smiley is a talk show host. He's an author, liberal political commentator, entrepreneur, advocate, and philanthropist. My hope is that our individual and organizational agendas will be influenced by hearing these highly accomplished experts present evidence about the social determinants that perpetuate poverty in communities of color and detailed tactics we can employ to address them. I am confident that next week we will return to work well-armed and with renewed momentum. The discussions we hear today will endure for a few special reasons. First, there are so many people who are smart in this room. Second, your participation is not just welcomed, but essential. Our shared commitment demands that we meet these issues at this university, in our city, our state, our country, and beyond our borders. Finally, the problems and solutions we discuss establish a baseline of truth, a testament to real injustice that informs the lives of so many people whose suffering must be reconciled with our highest ideals.